That's not what went on. There you go again. You just do the same thing every hearing.
That was signed just privately.
You keep distorting the truth. It is stunning how you do that. Senator, we are here at a committee to look at a virus now that has killed almost 900,000 people. And the purpose of the committee was to try and get things out, how we can help to get the American public. And you keep coming back to personal attacks on me that have absolutely no relevance to reality.
Dr. Fauci and Senator Rand Paul yet again got heated on Capitol Hill today as Fauci and other health leaders testified before the Senate on the response to the pandemic and the surging cases of Omicron. Dr. Fauci said not only is Senator Paul politicizing the pandemic for profit, but repeated false accusations by Paul have also led to death threats against Fauci and his family. Fauci cited the arrest of a California man last month who was headed to Washington with an AR-15, several magazines of ammunition, and a hit list, including Fauci and multiple other lawmakers, most of whom were Democrats. If that's not jarring enough, the hearing today came just as the U.S. shattered a new record for COVID hospitalizations. More than 145,000 people are now hospitalized. That's higher than last winter's peak, and it includes more than 4,400 children. Reuters and other news outlets are also reporting a record 1.35 million new COVID cases in just one day. That's more than anywhere else on the globe. That comes as the World Health Organization is warning of an Omicron tidal wave that could infect more than half of Europe in the next 2 months. They're urging leaders to strengthen masking rules and increase safety practices. Back here in the U.S., the CDC is reportedly considering recommending Americans now start wearing N95s or KN95 masks rather than cloth masks because they may provide stronger protections against spreading the virus. Schools are also scrambling to adjust. Students in the nation's third largest school district, Chicago, will be returning to in-person learning tomorrow after the teachers union and the city reached an agreement. After several days of cancellations, the mayor said the city will increase pandemic safety measures to alleviate fears from teachers, parents, and students. That comes as hundreds of students in New York City held a walkout demanding remote learning options. Mayor Eric Adams has said he is committed to keeping schools there open. Joining me now to discuss all of this and more is emergency physician Dr. Rob Davidson. Dr. Davidson, what strikes me most are these two numbers, this record number of hospitalizations and the record number of cases. How striking how should we contextualize this? We keep, as of late with Omicron, we keep hitting record after record after record, and to the point where we're almost numbed out of being shocked by the number of people infected or affected. How are we supposed to contextualize this?
Well, we have been saying, and thanks for having me, I appreciate it. We've been saying forever, ever since the vaccines came out, that if we don't get enough people vaccinated here and everywhere, here and across the globe, new variants are going to be popping up because as the virus circulates among people and gets passed around and, it mutates. The virus has mutated many times, and this Omicron variant is a mutant, is a strain that is spreading like wildfire. It is the most contagious thing we've seen, almost as much as measles, one of the most contagious pathogens we've ever seen. And so it is spreading like wildfire, and it's spreading everywhere. If you look at the numbers in this country, in every single state, the curve looks like the curve of the U.S. It is a straight up curve. It is the highest it's ever been. And that didn't happen in previous waves. You remember back last year in February, March, 2020, this hit, big cities like New York on the East Coast. It hit New Orleans. It hit Detroit in my state of Michigan. In the wave over the last summer of Delta, it was mostly the southern states. And now in the most recent Delta wave here, we're still digging out of it in the upper Midwest and the Northeast. This is hitting everywhere all at once. It's stressing out staffing in hospitals. Previously, we had roving teams of doctors and nurses who could go from place to place. There's a big market of travel nursing, travel physicians who could go and plug the holes in these places. Now these holes are everywhere. And that's this crisis that we're really looking into now in the next several months.
So let's put that in kind of global context. The U.S. now has nearly 1.4 million cases one day, right? More than any place on the globe, even of countries that have larger populations. Do you think that that is mostly because those countries are not doing good record keeping and reporting all the cases they have? Or is there something anomalous about the United States that is making more cases here than in other large countries?
I think certainly we're doing a lot of testing, a lot more testing than we have done previously. But the numbers don't lie. The test positive rates are off the charts as well. It isn't like we're testing, hundreds of millions and a million are popping up and it's, just a 1%. I mean, we're seeing test positive rates of 20, 30+%. I know in our region, I think it's similar in a lot of different places. So there's something about, again, when this Omicron strain hits in a certain population, and it's hitting here now hard, it just spreads and spreads and spreads. The other piece of this, where I work, we only have about 45% of people vaccinated. In low vaccination pockets in this country, it's going to spread even more. And those are the folks that are going to end up not having the so-called mild disease. For anybody, this is a real disease. This presents real risk. But for those who are unvaccinated, man, those are the ones that are still coming into our hospital. Those are the ones getting intubated and getting put on ventilators, and those are the ones at risk of dying.
So Omicron was first identified in South Africa. We don't know where it originated, but it was identified there. Thank God for their doctors for identifying it. It showed up in the U.S. shortly after it was identified in South Africa. But in South Africa, their doctors now think that they have plateaued and may have passed their peak. Why is the U.S. not responding, our curve not responding in the same way that the South African curve has responded?
Well, I think the reality is we are doing more testing. Now, South Africa had done an amazing job of genomic sequencing to identify this variant. Thank goodness they did. Unfortunately, they were punished for it by travel bans, and yet they got us this information we've needed. The U.S. wasn't doing that, so it could have been here sooner. But they don't test as much, as big a part of their population. So it still could be growing in certain parts of South Africa that aren't getting as much testing, because you're still seeing the excess death rate in South Africa is still significantly higher than it ever has been. They may not be recorded as COVID-19 deaths because people haven't been tested, but a lot of them probably are. So we don't know exactly where they are relative to that. And again, remember, it hit there, or at least it was identified there, at least a month or so sooner than it really started showing up here. So, hopefully we're looking into our future in the next 3 to 4 weeks. We hope it's only that long before we start really coming down. But that peak could be so high. That's where we stress out, us folks in the hospital, worrying about what that's going to do to us.
So the government now is saying that they may switch their recommendation on masks to N95s and KN95s and away from cloth masks. We were told for a very long time that, people that, by the CDC director, not the CDC director, but by government officials, that they weren't recommending the N95s because maybe people wouldn't wear them, they were uncomfortable, maybe they're a little bit more expensive. And any piece of cloth on your face was better than no piece of cloth on your face. People got conditioned to that. I have a drawer full of cloth masks in there because I was told that that's what I should. That was fine. I now have bought N95s, but if the recommendation changed, are there enough N95s, K95s for people to get? And do you believe that the government should be subsidizing, giving out masks, producing masks and supplying them to people, particularly people who just can't afford to switch it up and go out and buy a box of $50 masks? What do you think how that recommendation should unfold in the population?
Yeah, I think everything you just said is true. It is true that having anything over your face and your mouth and your nose is better than having nothing. But having N95 or KN95 is the best. It's what we've been using in the hospital. It's what I wear every day and change out every day. The other part of this is absolutely the government should be, if not supplying, at least making sure folks who maybe can't afford them or can't have access can get them. Sending them to every household, I'd be honest with you, that would be a waste in about a half the households in the county where I work, because folks don't wear any masks. Folks don't want to do any of it. But for folks who want to follow these instructions, want to protect themselves and their communities, they should absolutely be available. And if that means that the government is providing them or at least subsidizing them, yes, we should do that.
Yeah, just a quick yes or no before we go. So you should change your N95 every day?
We do in the hospital, absolutely. Now, if it's not soiled, if it's not, if you haven't been in high risk areas, you're probably okay wearing it more than one day or so. But definitely in the hospital setting, we do.
All right, Dr. Rob Davidson, thank you so much for joining us tonight. I really appreciate your time.